Okay, hello everybody. This is the start of our session this morning in the Rewired Summit, where we're going to focus on the learner as much as on the learning. The Rewired Summit, and I want to give a quick shout out to Tariq Al-Gurg and the Dubai Cares team for coming up with this brilliant idea of rethinking, of rewiring education as the world comes through the COVID pandemic. And when we think about rewiring education, we need to think also about the learners in the learning, because the learners, of course, have been massively impacted by the epidemic itself. And what's happened is that the world has rallied around that, and that the countries themselves have gathered around to identify what is the key issue as they build back. And one of the key issues they've identified is school meals, school health, school nutrition, building back the well-being of the learners at the same time as they put in place the learning. And we have a great team here this morning to talk about that. And many of the teams are actually from the non-state actor area. And I'm just holding up the GEMS report, the latest GEMS report that just came out on Sunday, to remind you that non-state actors are a key part of the support structure. How do non-state actors, how do NGOs in particular, how does the private sector support the way that countries build back after COVID? And that's going to be the topics that we're going to pursue today. We're going to have five great organizations, five very different organizations speaking with us, and then we're going to hear from Carmen Burbano at the World Food Programme to give us her view on the kinds of support that we're hearing about, and then we're going to open up to questions in the hall. So let's get ourselves going with a presentation, the first presentation of the day from my colleague on my left here in person, Carol Karuki from the End Fund, Vice President from the End Fund, to talk about the End Fund's work in this area. Carol.
Thank you very much, Don. My name is Carol Karutu. I am Vice President of Programs at the End Fund. The End Fund is a private philanthropic organization that seeks to end 5 of the most common neglected tropical diseases. As I speak to you today, about 1.7 billion people suffer from neglected tropical diseases. The majority of those are actually children. Neglected tropical diseases have severe negative impacts on a child's education. As you can imagine, 2 of the neglected tropical diseases, intestinal worms and schistosomiasis, cause anemia, they cause malnutrition, cognitive dysfunction, and they also impact physical growth, causing stunting. All of these have very negative impacts on education. They impact learning potential, they increase absenteeism in the schools, and they also, sadly, impact a child's ability to play. The school platform, the schools in general, provide a great platform for deworming programs. For example, in 2020, even with COVID, the End Fund funded programs were able to reach about 60 million children with deworming programs. In 2019, 70 million children were reached through the school platform with deworming medications. And in 2021, we anticipate about 80 million children will be reached with deworming medications. Research shows that in comparison to schools that have deworming programs, in comparison to schools to programs that support teachers or textbooks, deworming, actually school-based deworming, is the most cost-effective and has the greatest impact on education. Additionally, over time, children that have been dewormed also benefit from greater earning potential. Actually, there is research from Nobel-winning prize winners that shows that children that are being dewormed have significantly higher earnings, thus they have more incomes, and they have higher spending potential. So in conclusion, the End Fund as a private philanthropic organization has been able to mobilize funding from the private sector, from philanthropists, and works very closely with both ministries of health and education to get deworming in schools implemented. Thank you.
Super, Carol. Thank you for getting us off with that great story. And it's good that you reminded us that Michael Kramer, the Nobel Prize for Economics in last year, actually, worked very extensively on the impact of health on learning. So that's a great way to get started. Also great to hear that this philanthropy, the End Fund, is supporting 80 million children this year through those programs. So we'll come back to Carol, I've no doubt, with questions on this, but I want to move us on now to Shariha Khalid Erichsen, who's going to speak about Mission and Company, her company, and the role of the investment advisory firms in supporting development of school health programs. Shariha.
Thank you very much, Donald, and thank you to the organizers for inviting me to be part of this panel. I feel really privileged to be in this conversation as is actively evolving. And the topic of the panel on how we're responding in the context of the pandemic is just so crucial right now that we are absolutely thinking about who are the different stakeholders that are important as part of an action initiative. Traditionally, of course, school health programs has been largely in the domain of governments, but I hope that I can share a couple of examples from our work as a social enterprise. We're a social enterprise, Mission & Co. We're a fairly new entity, 3 years old, but building this new approach from over 10 years of experience running an innovation lab working on systems change. And so very specifically zooming in on these examples, one of the things that's important when we're thinking about interventions in the community, particularly involving the private sector. So the private sector, they're very careful about where they invest their money. At the same time, the public sector is very careful too about which private sector they engage with, and this also applies to multilateral agencies. So what we have found in our work is when you are able to build a neutral platform where multiple entities can participate, this is really the best way that we can bring different stakeholders together over a common cause. In fact, the origin of our name, our social enterprise name, Mission and Company, Mission and Co, really is about that. How do you bring different actors together over a common mission? And of course, with that, a common commitment to see results. And so one example is Health in Your Hands, which in fact actually is a platform that we built on the invitation of the UAE government's Prime Minister's office as part of the UAE's leadership strategy on the SDGs globally. And so Health in Your Hands curated 50 solutions from around the world that targeted, in particular, the private sector solutions or those from non-government organizations that had sustainable business models, but they worked particularly on the issue of the last mile. How do you address and deliver health outcomes in the last mile? And with the Health in Your Hands platform, we've managed to see participation from multiple multilateral agencies. They're part of the Advisory and Action Council. We have, of course, the 50 innovations in the portfolio, which just last week we shook hands with UNAIDS, and it's now actually 100. because they brought 50 from their similar platform. So this platform approach is one example I'd love to share. Perhaps we can expand on that in the conversation. And then very, very shortly, very specifically, an example from Malaysia, where we in fact still are doing some work with the Ministry of Education. So we started off that program. It was addressing the issue of safe spaces, creation of safe spaces for children in schools. We started off actually with an edible garden program called Garden of Opportunities, mobilized 10 private sector funders to invest in building gardens in 10 schools in the most impoverished area of the Port Klang in Malaysia. And 3 years on, some of these gardens are still there. These private sector entities are still engaged on the agenda, so much so that a couple of them have actually committed to working with us on addressing mental health in schools, in some of these schools. So perhaps during the Q&A I can drill down into some of the results we've seen over the years. Thank you, Donald.
Fascinating. And this is the richness, I think, of this panel, is the differences amongst the groups in approaches. And so the idea of the school as a neutral platform for delivery, I think, is one that we will definitely want to explore in the questioning side. So thank you, Shariha, for that insight. And now we're going to move on to actually two presentations around the role of non-state actors as implementing partners. And first we're going to hear from a panelist who is part of Sightsavers, the NGO that I'm sure you're all familiar with in terms of vision and NTD interventions in support of the public sector. So Sumrana Yasmin from Sightsavers, over to you, Sumrana, first of our virtual presenters. Let's see how this works.
Thanks so much. It has exposed at how fragile our education and health systems are. And there is a valid concern that children with vision impairment and other disabilities might be left behind in the recovery and rebuilding processes. While access to eye care is limited in many low and middle-income countries where we work, evidence from our programs show that schools can play a vital role in providing access to healthcare interventions. What we require is a functional, effective, and collaborative education and health systems that can deliver essential services. So focusing on a system strengthening approach and making inclusive eye health an integral part of these systems, we believe can help us get there. In Sightsavers, applying a systems thinking lens is something our program critically focus on, because that is something which is going to help us with a sustainable change. Our school health integrated programs are designed and implemented with existing education and health systems in mind. And this includes working with governments, civil society organizations, private sectors, and most importantly, communities. Within government, not only ministries of education and health, but engagement with ministries of finance, planning, and development is equally important, so we can have appropriate resources in place. We utilize schools as a platform to deliver health interventions, using deworming, eye health, and vision screening as entry point. Our financing model varies because it can be very context specific, but primarily we focus on multi-sector approach to financing, so we can support delivery of health and education outcomes. And our budget impact analysis and cost effectiveness studies in Cambodia, Ghana, Liberia, and Pakistan has helped us generate evidence on the cost of including eye health in integrated school health programs and show that these programs are cost-effective interventions. It also highlights that multi-sector collaborative approaches are essential if we want to deliver and finance better education outcomes. And it is something which is going to help us to create a foundation by which countries can move towards comprehensive school health and nutrition programs and contribute to achieving the targets of Sustainable Development Goals. Thank you.
Great. So thank you very much, Sumrana, for giving us that insight into the Sightsavers approach, the multi-sectoral approach, supporting both the health and education sectors around eye health. And important to note there the cost effectiveness analysis has also been conducted. Well, staying with the theme of eye health, I want to move on now to Nick Virr from the Fred Hollows Foundation to hear about the approach that, that the Fred Hollows Foundation is using. Nick, over to you.
Everybody from Northern England. The Fred Hollows Foundation, you may know, is a leading international development organisation. We've restored sight to more than 2.5 billion people in 26 countries, and we're seeking a world where no person is needlessly blind, vision impairment. Obviously, we're quite passionate about our mission and its relationship to education. Vision is the primary sense. 80% of what a child learns is through visual systems, and vision underpins lifelong learning. Yet 9 out of 10 people who are blind or vision impaired need not be. Not only does vision play a critical role in education and a productive, happy life, it also improves the impacts and returns from investments that we make in education. Consequently, I think we have a unique opportunity to reach the 700 million school children at a point in their life that offers an amazing return on investment. For instance, when a girl's vision is corrected, her ability to participate in and benefit from the educational experience is exponentially improved. For each year she stays in school, her income will rise by 10 to 20%, and ensuring school-age girls have good vision actually underpins gender equity. Eye health messages, actually, such as hygiene, outdoor activities, and nutrition, all have positive long-term sustainable impacts for the child and for their education, whilst the early detection enables cost-effective interventions that improves inclusive education. I guess one example I'd like to give is of a sustainable finance model is our Punjab School Eye Health Program in Pakistan. It follows the global best practice that has 4 key aspects, which is prevent vision loss, promote good eye health and health-seeking behaviour, screen at large scale, treat, such as with glasses, and refer them on more complex issues. Importantly, the government and other health, nutrition and community stakeholders, as Sumrana said, are key partners throughout. We trained and screened 1,100 teachers, 1,300 health professionals, screened over 156,000 children, getting glasses to 15,500. The eye health promotion to children, parents, school teachers and health professionals reached over 200,000 people, and some children became our vision champions. The policy briefs and training toolkits built for school administrators and health professionals with our government partners supports the sustainability model by ensuring that these practices become standard within the Ministry of Education and the district government. For instance, the Ministry of Education's teacher training now includes an eye health module, while services and toolkits are part of the district school eye health standards. At times, of course, the cost of children's glasses are part of national health insurance schemes and services, yet more often parents pay. And I actually think this reveals an opportunity for innovative public-private partnerships, especially in low-resource settings. And I throw a question out, might the private sector play a greater role in these low-resource settings in such PPPs? Certainly the Foundation seeks to have discussions with people about these sustainable partnerships. I guess in regards to long-term sustainable finance, post-project we're not providing grants. It's kind of a venture philanthropy kind of model where we use grant funds to cover the risks of developing, proving, documenting and priming the model, whereas the scale up, if you like, it's funded by a mix of insurance, the consumer and government funding. I guess it's important that we share our learning and build on such great programs together with educators, the health and eye health sector, government partners and private funders, and of course you here in the audience today. I guess given the child, that a child with uncorrected myopia will fall behind and more likely to drop out of school, that by 2050 over half the global population will be short-sighted, and that a recent survey from China showed that 87% of high school children had myopia, then school eye health is critical for the well-being of the next generation and of course our societies and economies. Thank you.
So thank you very much, Nick. And I think that the we've heard there from two groups working on eye health, and I always feel it's probably the easiest health intervention to understand in terms of its relationship to education. There are many of us here in this room, I know, will recognize that we really couldn't have made it through school in an effective way without the benefit of something as simple as glasses. And to hear Nick talking about how 200,000 children could be screened and 15,000 children given glasses through a relatively cheap intervention, I think is a great example of the kind of interventions where non-state actors can play an important role. And then moving to a final and different type of support. This is from a drug donation program, the program of providing treatments for children for common worms, and particularly the worm Schistosomiasis, the infection Schistosomiasis. So this is the Global Schistosomiasis Alliance, and we're going to hear from Johannes Waltz about their role in working through schools. Over to you, Johannes.
Thank you very much, Don, for the introduction. It's a pleasure to be here this morning and to have the opportunity to shortly talk about our investments in combating schistosomiasis, which is the second most devastating tropical disease in terms of impact after malaria. The cornerstone of and I'm talking here in my capacity as a member of Merck, the cornerstone of our work in schistosomiasis is the provision of up to 250 million tablets of praziquantel, which is the gold standard for the treatment of this terrible tropical disease, which we provide free of charge to up to 100 million school-aged children per year until elimination as a public health problem. This, of course, is a massive investment for Merck, which the company has committed itself to as part of its social responsibility and sustainability strategy. In terms of financing, it is in a way traditional philanthropy, but we see this increasingly as a way to create shared value, meaning societal and business value at the same time. As mentioned, we focus on school-aged children, and when it comes to implementing these large school-based treatment campaigns, we work with a multitude of partners and stakeholders, including ministries of health, ministries of education, international NGOs, academia, you name it, across the whole of sub-Saharan Africa. We believe that our focus on school-aged children delivers the greatest positive impact, not only from an epidemiological point of view, but also in terms of short, medium, and long-term economic impact. It's simple, and Carol already mentioned it. Healthy children who can attend school fulfill their educational potential, attain an educational qualification, can become active members of the workforce, which will be able to create social and economic value in their respective societies. We have recently measured this with our own model, which we developed. We call it sustainable business value, and the return on every dollar, euro, whichever currency you take, invested in the health of school-aged children is simply astounding. The current pandemic has certainly impacted our work in the control and eventual elimination of schistosomiasis, but we are confident, and if anything, even more motivated, that together with a multitude of partners and stakeholders, we will succeed in this endeavor and eventually get rid of this scourge of mankind and ultimately help creating a promising future for the many, many millions of school-aged children we serve. Thank you.
Great, thank you very much, Johannes. So thank you also for the donation of 100 million doses, 100 million children treated a year. That is a remarkable contribution, and I'm sure we now will want to get into some more of the detail of that. So we're going to, in a moment, move to ask you, Carmen, to give some insights into the coalition that's been established and the potential for non-state actors perhaps to play to play a role there, but particularly to hear about the coalition itself. But I'm going to, after that, we'll move on to questions from the floor. If people who are joining us virtually also want to ask questions, please do that in the chat. If you give us a contact name, we'll get back to you and discuss those questions that way. But for the moment, we're going to be taking questions from the floor, and questions can be to either the panelists who are here in person or to the panelists who are on screen, which we'll bring up again in a moment. But for now, Carmen. So Carmen, first of all, let me congratulate the World Food Programme on being the Nobel Peace Prize laureate for all your amazing work in supporting children. And then ask you if you could comment on the this incredible new coalition around school meals.
Thank you so much, and thanks, Donald, for the invitation to the panel. First of all, I just want to comment that what all of these different interventions have in common is the realization, and they've been working for many years, on using the school as a platform to deliver health interventions that are specific investments from the health sector, but that have direct impact on education outcomes. And in this summit and Rewired during the last 3 days, a common narrative has been how the education sector needs more innovative sources of financing, how to secure the financing that really is needed for achievement of SDG 4. So one of the things that we've been saying for a long time now is that one of the most important innovations of the education sector is working with other sectors. And what we've seen in this panel is really the leveraging the investment of the health sector, particularly now with these presenters, is providing huge benefits when it comes to SDG 4 targets. So that's one of the solutions that we do put on the table, and I would say that's the spirit in which the School Meals Coalition was built earlier this year. In the context of the Food Systems Summit, and particularly motivated by the fact that COVID essentially destroyed access to health and nutrition services, including meals, but also deworming and vaccinations and site screening, etc. Earlier in 2020, we calculated that around 370 million children lost access to meals and related services because of school closures associated with the pandemic. And so, motivated by that, government leaders led by President Macron and also by governments of Finland, the US, Sweden, Russia, and others created the School Meals Coalition. And the coalition is essentially a government-led call to action to restore access to these vital school health and nutrition services that, as we've seen today, are so important. So that's the first objective. The second objective is a particular focus on low-income countries that even before the pandemic didn't have access to these programs to begin with. We know that there's about 73 million children that were living in extreme poverty in low-income countries that really benefit disproportionately from investments in health and nutrition, that go to school hungry, that have worm infections, that have micronutrient deficiencies, and that could benefit enormously from investments in this area. So that's a second focus. And the third one is really looking at the quality of the programming. And part of that is what we've been looking at today, is how do these programs get integrated? How do we integrate site screening with deworming, with school meals, with local purchase of food, and how do we create healthier environments, including food systems, into what schools can do as a platform for human capital development? So you began this session by talking about the learner, and the fact that looking after the learner and the well-being of the learner is as important as the learning. We believe that if we work in a coalition like the School Meals Coalition, really that is the essence of it, is really looking at how are we looking after children. At the moment, the coalition includes 61 countries. This is a massive movement now. We never imagined it would be so successful. 58 partners have joined, including the major UN agencies, NGOs, and partners. And what this is really about is how do we all come together to support better research, better financing information, better data and monitoring for governments to make these decisions that they need to make in these investments. So we're very excited because I think a lot of the panelists here today are part of that movement, are part of the movement of integrating these services into schools as platforms.
Great. Well, thank you very much, Carmen, for that. It is an amazing story that this coalition has come together so well. It's one of, during the pandemic, I remember people saying something good must come out of this. This can't all be bad news. And this is part of, I think, some of the good news that's coming out is a recognition that education is so fundamental to the development of our societies, the development of our individual children, and that in looking after the health and well-being of children is so fundamental to education, that these ideas now are really getting rewired as we try and move forward from that. So we are going to have, if anybody's got some questions, we're ready, I think, with microphones to take those up. But let me get things. So please signal if you so we can bring you a microphone. But let me start, Carol. Let me ask you a question. You represent an extraordinary philanthropy, which, if you like, aggregates resources from many philanthropists.
Indeed.
And would you talk a little bit about the fact that it is health and education that's involved here? Is that seen as a positive by the groups you're working with? How do you manage that?
Yes, indeed, it's shown. It's seen as a positive. The fact that I believe Carmen has mentioned the integration, the fact that it's two different sectors. It's health sector, the education sector, and then the resources come from private philanthropists, the private sector, from public institutions, and also ministries of health, ministries of education. So it's really a whole coalition that comes together to ensure that the learner, in this case the child, gets dewormed and is dewormed as per the WHO guidelines, whether it's twice a year or once a year, and it's done in a manner that also ensures that both the learning and the education of this child is protected. And that's really convincing for the people that give us the money.
Yeah, I'm seeing a question here at the front. So thank you, Carol. I think that's I think a change in the way in which people are thinking, that we're not quite so siloed as we were perhaps in this. We have the question from the front here.
Thanks, Donald. I'm Bo Crowder from a consultant at Dubai Cares. A quick question about the School Health Coalition and how it actually manifests itself at national levels, because we're obviously talking about non-state actors working together, and we've worked a lot, before in this sector and trying to align. Could you elucidate some of your experiences working at that national level and the sort of plan forward of how ministries of health and education really do come together, if there are any examples before that you're building off as well?
So that's a question in part, I think, to Carmen for the conceptual idea of working at the country level. But I'm also going to just ask if any of the panelists would like to address that question. So Carmen, if you could just comment.
So maybe two things to answer the question. First of all, the coalition and the efforts that were initiated this year is really inspired and builds on the back of years of collaboration from actors like the End Fund, like Sightsavers and others that have been already collaborating at the country level. These programs can't really function without the collaboration of the Ministry of Health and the Ministry of Education working together at a minimum. We know that in most of the countries that are implementing integrated school health and nutrition programming, there's already some sort of multi-sectoral coordination mechanism. There's something that has already been created by the government. Usually these are working groups that incorporate at least education, health, agriculture in some cases, social protection in others. So what has been discussed, and of course this is very context specific, so it really depends on the country, is first of all, if there is already a multi-sectoral group, how can this group in the context of the coalition decide to make a national commitment or a national pathway for where the country wants to be in 2030. That's the question of the coalition, is really what does the government and also the government's partners want to do to get us at 2030 in a better, more integrated program for children in that particular country. And what we're asking is, can those partners come together and build that pathway and that plan? Now, where that doesn't exist, and in some countries it's still not formalized, maybe it might be a little bit informal, the mechanisms, could the government, first of all, formalize a multi-sectoral working group to work on these issues, but also build and bring other partners, UN agencies, NGOs, groups of civil society that are very active in the space already in schools, but that really need that convening power of the government. So that's essentially what we're trying to aim for, and 2022 is going to be an important year to help get some countries moving. Rwanda is a very good experience at the moment of a country that has already done this, that has already taken leadership here. And the president of Rwanda just recently announced that out of this multi-sectoral conversation, the government has committed to moving from covering 640,000 children to 3.3 million children in the next couple of years.
Amazing, amazing. This is real productivity, and I'm seeing our colleagues, our virtual colleagues, nodding their heads. So I'm going to ask Sumrana first to comment, and then Nick. Sumrana.
Thanks, Donald. Just completely agree with what Carmen just mentioned, and just to add another element which has helped us to push the agenda forward at the national level is applying a demonstration approach where the concept is new, but working with different stakeholders at a provincial or state level to pilot a project and have that evidence in place to then push for a policy change for a national level. And that is something which we have managed to successfully do in quite a few programs when it comes to school health integrated programming. And another thing which I feel is equally important, how we manage to engage communities in these conversations, because that is something which in the long run make sure that people who need these services, kids who need these services, their parents, they then, are pushing these messaging and these policy changes at different layers within the government system, from national to provincial to district to sub-district levels. So that is something which I feel is equally important.
Great. Let's not forget the role of the community, the essential leadership of the community in these areas. Nick, can I ask you for your comments on that? So we're not getting sound from you at the moment, Nick. Maybe, I don't know whether we're muted at your end or at our end.
No.
Do we have a problem at our end, or is that, I think Nick, let's just hold your answer for the moment. We'll come back to you. Actually, I'm going to move us on to Shariha. Actually, isn't this is what happens to us all during Zoom meetings, isn't it? Yeah. Shariha, can I ask you to come in on this one?
Yeah, thank you, Donald. I think it's a really important area to consider how we move forward, particularly in the context of a bigger readiness that we have seen in the private sector also to collaborate with government. This really is a moment that we need to use for the benefit of the children. One thing we have seen recently is a bigger readiness to work with unusual partners, and also to focus on the child. We've been having this approach for many years in our work of our tagline is investing in people and the planet. One particular program that we funded, so this is the thing with the private sector. Sometimes we come in as investors, as funders, as program implementers, as solution providers, and sometimes just as conveners So we're quite diverse in that sense. And the private sector, you can have a private sector firm that has 3 employees to those who have, 300,000.
Yeah.
And so when we're speaking about a national context of collaboration, it really depends on the readiness of the ecosystem in that country, and of course in that the private sector and the public sector and other parties. And one difference we've seen is this bigger willingness to work with the child. So every child matters in that sense, rather than, oh, we're an organization wanting to work with another organization from another sector. So if we're going away from this panel, I hope that we can all consider how can we bring it back to the child, so every child is empowered to be able to address his or her own health and education outcomes. Something to consider.
Brilliant. That's excellent. The sense of the missing private sector, I think, is very strong in the way we think, the way we're failing to think about some of that. But also, I think the direction towards empowerment of children is crucial to this. Our time is lamentably running out, so I'm just going to go around each of the 5 panelists and ask them for a final. It's going to have to be a quick sentence each. So, Carol, can I start with you, and then we'll go in the same order as before. Carol.
Indeed, I think I'll just reiterate the importance of looking at integration, the health sector, education, focusing on the learner, focusing on the teachers, but also because the teachers in themselves also help bring, in this case, deworming education to the communities in addition to the child, and they too learn. And then looking at the power of mobilizing across sectors, non-state actors, state actors, the pharmaceutical companies, all of them that bring deworming programs to schools. Thank you.
Great. Shariha?
I'll just reiterate my point earlier about focusing on the child, the learner, the individual, and then the organization or the structures around that individual, and of course the community, and then the broader ecosystem as a whole. So to be very structured about looking at these different areas.
Super. Sumrana?
I would reinforce that let's be more creative about working together so we can make sure that in following the agenda of 2030, we leave no one behind. So our children are happy, healthy, have access to right healthcare and education.
Nick?
Shall we try again? Can you hear me?
Yeah, we can hear you great. Go ahead.
Oh, good. Yeah, actually, I'd just like to look at the actual panel you put together, and I think it's representative of how we do need to work together. Where you have Merck, a large pharmaceutical, some non-state actors, Sightsavers and Fred Hollow's work well together already in many countries, but also the idea of base of the pyramid, incubators, and then the World Food Programme. So working together, I think, is the way to make it work. So thanks.
Brilliant. Johannes?
Thank you. I think most of it has been said already. The thing which remains to stress over and over again, I think partnership, coordination, cooperation, collaboration is at the heart of all these endeavors. We've come a long way, but there's still so much more we can do. And we are happy to be right in the middle of working with all our partners, stakeholders, right across the area to achieve the ultimate aim, which we all work for.
Great, thank you. Carmen, do you want the last word?
Well, I think I'll just echo your opening, which is if we focus only on the learning but not on the learner, we won't get very far. And I think this panel has illustrated how pooling together the resources of various sectors can really get us at that focus that should be both on the learning but also on the well-being of children and what they need to be able to thrive. This conference is our main audience is the education sector, and my plea to the education sector would be reach out to the other sectors. They have a lot to contribute and to help you reach SDG 4, which is the focus of this summit. Thank you, Don.
Brilliant. That's us out of time. Thank you all thank all the panelists for your fantastic contributions here and remotely. And thanks for this, this great audience for participating. There's another session later. Great. Thank you. Thank you all.
Yeah.